Now, to administer an eye drop, you really do need to do your 6 checks and make sure that nothing is going to go wrong first. It's the 6 checks of medication administration that are going to actually keep you safe. Alright, now we're going to give Mary her Refresh Tears eye drops here, and it says Refresh Tears eye drop here. Make sure that it's exactly the same. Go over on the bottle and check that the expiry date is still current. Alright, when you've done that, make sure that you've got the right client, and today we've got Karen, who is pretending to be Mary Harrison. Alright, so Karen, thank you very much for being here with this. You need to go off this non-packed regular medication because this medication isn't in the pack, but you're going to have to sign here. Alright? Once you've administered the eye drop, you'll need to find the date. And today is the 3rd, and you just sign opposite underneath the 3rd, and that's where you put your little signature when you administered. So I'm happy that I've got the right medication and it's in date. How many doses am I supposed to give Mary? It says here, instill 1 drop, both eyes, once a day in the morning. Now, for the purposes of this demonstration, you would also check instill 1 drop into both eyes. So the documentation has to be exactly the same and the right. When we say right documentation, we're actually checking that this is the same as that, alright? And that there's no differences. Now, to actually administer the eye drop, there are some rules that you need to remember. Always put your lid onto a clean surface. When you first open the bottle, you must write the date that you've opened the bottle, and it gets discarded 1 month after you've actually opened it. You need a tissue. If it's something like Refresh, do you need gloves? Well, actually, unless there's an infection in the eye, you don't need gloves. You've washed your hands and you can put this eye drop in the eye quite safely, and it's very acceptable not to have gloves for something like this. Now come up to your client. I've checked that I've got Mary here, and I've checked that my medication is the right one. I am not giving Mary her oranges and penicillin, and the expiry date's current. The dose is 1 drop in both eyes. The route is into the eyes, both eyes, not just one. Occasionally you'll get an eye drop medication that tells you only one eye, like the right eye or the left eye. It is the correct time to do it, which is in the morning, and it's now, I'm going to pretend that it's 8 AM in the morning, and Mary's having her regular eye drop and the documentation's all right. So it's good to go. Next thing you need to do is actually check how fast this nozzle drops, because every nozzle has a different drop rate, and you'll have to work out how to do that fast and efficient. You don't want to be over the eye doing that and trying to get that eye drop out, alright? So just learn to get that, just waste a drop on the tissue and learn how to get that drop out fast and efficient. Next thing you need to know is how to put your hands on somebody's face. Really important that you don't invade people's body space when you're actually administering medication. Now on Karen, her body space actually extends from her ear and comes out here and goes all down the front of her body. So it's very important that I do not do this, alright? It's also important that I don't enter her body space from above, because that's very threatening. So no way should the medication actually be in the body space, alright, or the personal space. What you need to do is ask your client to take their glasses off if they're wearing any. Give them a dabbing rag so they've got something to hold on to and they're taking part in it, and so there's more cooperation involved. When you come up to the client, come in from the side. Now remember, you've got to actually pull down the eyelid, the bottom eyelid, and the medication is supposed to go in the sac where the conjunctiva is, not onto the eyeball, which would make it very uncomfortable. So Karen, if you could look up for me, pop your head back, look up and just look away from me. I'm not going to do it yet, I'm just going to actually talk a little bit first. When I come up with Karen, this is my dominant hand for dropping medication, my left hand. Alright? My right hand, I either have a tissue or Karen has the tissue, it doesn't matter. And I'll come up underneath to the side of Karen's personal space, and I'll come in from the side where she's not going to actually see. It's a little bit like an SAS sneak attack. I will then do that little rolling effect that I told you about. Remember, don't pull on her face like that. All she'll need is plastic surgery and it won't work. It won't get the eyelid down. You've got to go in underneath like that and do a little rolling in and down effect like that. Make sure, the other rule, very strict rule, is that when you're going to put an eye drop in, the hand that is doing the dropping is always anchored to either your other hand or the face. On this side, you would anchor it to your client's face. So your little finger along there should be in contact at all times with skin. Never drop like that, which I see a lot of people doing. It's dangerous. Because if your client suddenly turns their face towards you, you could end up stabbing them in the eye with the nozzle. So to keep safe, it's an occupational health and safety aspect. Remember, anchor the hand. Pull it down. And are you ready, Karen? I'm going to actually pop the eye drop in. If you could just pop your head back a little bit more for me and turn it that way slightly. Yeah, that's it. Look away. So the eye drop will then go in just like that. Okay. And you can wipe. Now, if you're going to do the eye drop in the other eye, it's a little different to how you put your hands. What you need to do is actually come around here. Now, my dominant hand is out here, so I can't actually put it against the face. What I'm going to do is I'm going to come in here. I'm only entering from the side. The only part of the medication that is actually in the client's body space is the nozzle and down from there onwards. All right? Keep the rest out of her body space and keep yourself out of her body space as well. So you come in here, do that little rolling down effect. This time you will anchor the little finger on your hand. Stay up high enough to drop the medication in. Can you just pop your head back a little bit more just to help me? Thanks. And pop it onto the conjunctiva, but don't go close enough to let the eyelashes contaminate the nozzle. Never ever should an eyelash, which has a lot of bacteria on it, touch the nozzle of an eye medication. All right. You okay? Yeah. Good. Now what I'm going to do is I need to teach you one more aspect of eye medication. And that is, if you have to actually give somebody an eye medication or an eye drop that has an infection. So I'm going to pretend today that Mary Harrison here, alias Karen, but alias Mary Harrison, right, has actually got conjunctivitis. Conjunctivitis is a very, very severe and very contagious eye infection. And it can leave the eye weeping and putty and with a lot of goobies. I call them goobies, or muck around the eye. So before you actually administer the eye drop, what I'm going to do today is I'm going to pretend, in fact, I'm going to pretend with this one here because this is what you'll be working with. I need a cup. A plastic cup is great if you can get it, or a very clean kitchen cup that's had boiled water in it and it's been sort of like washed and sterilised, very clean. Put some cool boiled water in here and then pop in 6 gauze like that. 1, 2, 3, 4, 5, 6. All right? Dampen them down. Don't put enough water in to saturate them because you don't want conjunctivitis and water running all down the front of Karen. Or Mary, in this case, sorry. You're going to need gloves, all right? You must wear gloves anytime there's an infection. So what I'm going to do is I'm going to put my gloves on, and then there are 3 parts to this. Part number 1, check that you've got correct administration and go through your 6 rights. Part number 2, clean the eye, and part number 3, put in the eye drop, all right? So let's just go through the medication here. And today, it's still refresh eye drops, but I'm going to pretend that it's chloromycetin and that it's actually an antibiotic, which is what we use for conjunctivitis in a hospital setting. So, check that the name is right, and in this case it's still refresh, and the expiry date is on the back of these little disposable containers, and the expiry date is the 3rd, 2012. Now what you'll find is that this container is mostly label, which if you squeeze it won't do anything. It's the little bubble with the medication in, and then what you need to do is just twist that to get it off. All right? Now when you do that, you've got your eye medication ready. You know that it's going 1 drop into both eyes, and it is the right dose, 1 drop, the right route. Is the time right? Yes. And is the documentation all matching up? So whatever is written on here, and it should have Mary Harrison's label on here, should actually be the same as here. Mary Harrison's details and the name of the medication, expiry date. Obviously you're not giving her oranges and penicillin because that's what she's allergic to. So now what we're going to do is I'm going to actually give Karen, or Mary, sorry, her dabbing rag. I'm going to squeeze all of these out, and I'm going to show you how to clean an infected eye before you put a medication in. Any area of the body, it's not just eyes, that is infected and needs cleaning before you instill any medication. So what you need to do is fold your gauze up, I've got that like that, into 4. So you've got a nice big fat corner that will actually go into the corner of the eye and wipe it like that, alright? So just have a little chat to your client while you're getting all of that ready. These are damp and they're now folded into 4. I think I've got almost all of them ready. Yep. Okay. Now, Mary, if you could just close your eye, I'm going to actually clean the top lid for you. I'm just going to wipe it over gently and I'll tell you when I'm about to touch your eye, which I am now, alright? And it's just like that, a nice gentle wipe. Only do it once. Never wipe more than once. If you might wipe again with the same gauze, you're going to find, if you wipe again with the same gauze, you're going to find that you've actually taken the germs out of the eyelid and put them back into the eye, and the eye will actually get worse. So only ever wipe once and then throw away. Get your next gauze and wipe again, having that fat corner in the corner of the eye. Pop it into your germ container, which is what that cup is now, and do that 3 times until you're happy, 3 or 4 times until you're happy that the eyelid has got all the goobies cleaned off. Alright, now what you're going to do is clean the next lid, which is the bottom lid. So Karen, could you open your eye and look up, and you get the fat corner in the bottom, come up from below like that and wipe gently along the hairline of the eye, being very careful not to scrape the eyeball. That goes in there then, and we just do that 3 times, 4 times if you need to, until you're happy that the eye surrounding is clean from all the exudate that might be coming out of that eye. Okay, so now you're ready to actually put in the eye drop. Make sure you've got gloves on, so it's alright to pop a bit of medication onto the glove, never onto your bare skin, just the glove or a tissue, alright? Make sure you know how fast and how hard this is going to drop. Now from this angle, I would do the same thing. I would come in here, and I would come in very carefully. I'm just going to pull that down, Karen, and I would anchor my hand against here, alright? And I'll just pop in the drop for you into, just pop your head back a little bit further to help me. Thank you. Okay, now stay up really high. Okay, I've just administered an eye drop into this eye that has conjunctivitis in it. Now, it's very, very important that you remember a few things when you're dealing with somebody who's got an infected eye. Don't allow them to dab themselves. If they want to dab, make sure that their hands are washed immediately after they've actually touched their eye with the tissue. Alright? It's better if you do the dabbing yourself, so I'm just going to dab your eye, Karen. Close your eyes, that's it, like that. Then what you need to do is you need to be very careful about disposing of these germ contaminated articles. The medication will need wiping over with some Alco Wipe if it's a permanent bottle. This is a disposable one, so I'm going to pop it into the germ cup. I'm also going to pop in the germy dabbing rag, and what you do is you put your hand over the cup because the germs are all over your glove. You fold your glove over the cup like that. Make sure that you put your hand over the top and then pull your glove off like that. And then what you do is do it with the other glove as well. So the hand goes over the top of the cup, grips it, and you turn the glove inside out over the cup, so that the bacteria that cause the conjunctivitis are actually enclosed and aren't going to infect anybody else. Do not put the cup down on your work surface. Go and pop it immediately in the bin, which I'll just pop over there. Wash your hands, alright, and only after you have done that are you allowed to sign the medication chart or to touch any of these other common use surfaces. So that's what you would do. You would then get your pen and sign the chart. It's a really good idea to monitor your client's eye, because you need to know that